you, Rachel, and thank you for those opening remarks. And this fits the first challenge around integration. 15 minutes is going to be a real job with me and Paul on the stage here.
Not possible, Tim.
Impossible. So we're going to work this through. The long short of it is we have something really exciting going on in Dudley. One of 29 sites for this Vanguard work, which is about how we work in a more integrated way. Not from an organisational point of view, but from the citizen's point of view. So what we're going to do is Paul's going to say, and I'm going to keep you to time, Paul's going to go through the content in terms of the substance of the presentation, and then I'm going to put it back together at the end, and then it's a sales pitch for the workshop, because we're going to ask some questions of which, if you're interested, you might want to come along and start pushing and challenging. So, we thank you very much. And I'm going to hand over to Paul. The clock is ticking, Paul.
Great, thanks.
We're going to be the new crime and police arrangements. As you see, they sit at the back. So we're going to have a uniform in time, so you'll recognise the NHS and the local authority. But Paul, over to you.
Yeah, we're disputing whether we should use health and wellbeing board colours or not there. Right, so just in terms of what it means to be a vanguard, there are the NHS England set out in the autumn that health and social care isn't sustainable in its current form unless we radically redesign the way care is delivered. And they invited systems and providers across the country to put forward their ideas, and then selected 29 sites to really take forward and test out new ways of working. And that's really what the Vanguard proposition is all about. We've been selected as one of those 29 sites across the country to lead the way in terms of looking at how we substantially change the way services are organised. Now, where we've got to so far, that starts with the principle of starts with the integration work that we've been doing, and how do we bring services together to organise them and bring our staff together, particularly, to organise them so that we start to take and are able to take a shared responsibility for delivering shared outcomes with our local population. So part of our model, which is going to be seen described here, is about the fact that one of the things that's unique to the UK around the world is that the person is registered with a GP. And in supporting that GP, we've put together multidisciplinary teams, which Rachel, Councillor Harris already referred to, from all the agencies across health and social care that are working together with the same population. And I'll show you in a second just some of the feedback we're getting from both staff and patients about the consequences of that. But the underlying principle behind it is that what we need to try and do, and what we're aiming for, is to enable our frontline staff to work more effectively together, to maximise their potential, to work with each other effectively, and to work with their local communities effectively. And that's really what's at the heart of the model of care. But what we're also very clear about is that we're not quite sure where we're going to end up over the course of the next 5 years, but it's really fundamental that we can't stay with the current structure and design of health and social care. We are going to have to radically transform if we're going to maintain and continue to improve on the quality of care that we offer, as well as maintain sustainable provision, given that we're in an environment where we're reducing our resources year on year. So as part of the model of care, as well as the concept of person registered for practice supported by a team of staff that work with the same population, we're also received feedback through our public forums about what are the key issues for people in terms of the type of care and the outcomes they're expecting us to deliver on. And what we're hearing is three very clear themes. People want good access to care. For those people particularly living with a life-limiting long illness or a long-term condition, they want continuity of care. And for those people who have got more complex conditions, frail elderly, those with complex comorbidities, they want to see the services coming together so we've got much better coordination of care. And when we look at if you look at it, it's how it kind of splits across our population. There's about 250,000 of our population don't really need met services very often, but when they do, they want good access and they want early diagnosis. There's probably about 50,000 of our population that are living with long-term conditions that would like to see a continuity of service. And then there's about 10,000 of our population that live with multiple complex comorbidities that really need our services to come together to work more effectively and take that shared responsibility. And we're doing a range of initiatives across the whole system, which I'm not going to go into in any detail. In fact, got no time, but I could talk to you about it for 3 hours if you like, about all the different areas of work across the whole system, across health and social care that we're putting together and we're working on to deliver better outcomes for our population. But in essence, for me, what it comes down to is how is it that our staff are working effectively with our population? Because in the end, the NHS and the wider public sector is a people business. It's about the people we serve being supported by the people delivering the care to them. And I just want to kind of leave you with some of the early feedback that we've been getting, both from our staff about starting to work differently in this way, and our patients. So I'm just going to read a couple of the quotes out here about what our frontline staff are saying. It's more holistic and person-centred. It's a good idea that could get much better. It's rewarding seeing how integration has re-energised the team members, and the enthusiasm of key professionals in the service has encouraged more staff to want to become involved in this new way of delivering health and social care. And the new integrated way of working has helped me better integrate with teams, understand what services can offer. Pulling this all together in a regular meeting has given me greater autonomy. This has directly improved patient pathways of care and has reduced unplanned admissions to hospital. And the really positive thing that I'm seeing now is across health and social care, we're seeing our staff really energised about working better together. And actually their motivation and also the outcomes that they're starting to see is improving as a result of this. Now, what also I find interesting though is when we look at our, talking to our population, although we initially came at this from the CCG's point of view around how do we deliver better health outcomes, a lot of some of the initial feedback we're getting from our population is almost that those health outcomes are a given, but what we're actually enabling them to do is get better connected back into their community, and when we start looking at them as a whole person, actually the kind of issues that they're coming back to us don't really talk about health. So, if I just read some of the quotes out, just elements of it from the feedback we're getting from people is they talk about my life is getting better and I feel I would get back into work. I feel more aligned, to be honest. I feel safer now, really secure. So the kind of the work that we're doing is much broader than just simply are we treating people with the appropriate treatments. It's actually, are we engaging with people in what's really important to them to help them live a better quality of life. Shall I do this slide?
Yes, if you could. In fact, we'll go on to the last question. So these questions are kind of designed to tease out some further conversation. As Paul said, it's a process, it's a piece of activity that's already developed. But as you heard through some of the comments, particularly when people use and access the support currently, it's probably not dynamic enough. And is it just innovation? Are we just tidying up the environment? Or are we really wanting to transform the way that people and citizens receive, but more importantly take control of the services and support they have responsibility for? It isn't just about social work or healthcare or nursing. So I'm really pleased, for example, I'm going to embarrass it up there. Mark Rogers is here as the Chief Officer for Housing. And I know we're having conversations, or starting to have conversations about actually, if we look at it, a lot of people whose needs and assistance we support, and children families as well, not just people with long-term conditions, live in housing, social housing. And they have officers who go through the front door and talk to them about how they're coping in the home, and they talk to them about a range of things, about rent arrears. But actually there are other things that they might see or observe that we might think differently about how can we work with communities and neighbourhoods and people in a different way. Are the design principles right? So one of the things that is brilliant about this model is that actually we're beginning to have a far better engagement and discussion with a range of partners, and on this occasion I'm going to talk about the first sector or the third sector, depending on where you come from. But we'll use the phrase Andy, first sector, because actually there lies some solutions in terms of co-production. There lie some solutions to design principles about how we use heat maps and where we know where demand or resource requirements are coming from, to think about differently in terms of how we look at neighbourhoods and communities and assets, and talk about assets and strengths rather than saying, you need this, you've got a problem. So we may not have the design principles right, and we want further conversation about that. Workforce. In one sense, we've got a brilliant workforce, but actually have we got the right workforce? Have we got the right skills? How is it that some people can deal with these issues and these complex life situations without any professionals when the offices close or when the services reduce? So what is it about how we can make greater expertise of citizens and people's experiences to help shape and review the model? And maybe we get the right proportion of professional people and other people who are capable and can deliver, support, assist in different ways. What are the implications of commissioning? Are we commissioning the right things based on what we've always been told this is what people want, when actually we haven't had those conversations? Or do we need to think differently about what we do? Do we need to think differently and say, actually, we might want to delegate? You might actually use that delegating resource closer to the front line. We've still got to find 40 million just for the council alone over the next number of years in terms of austerity. So this is not more money, it's about working with less resource, but doing it smartly and differently. So we're interested in your views, conversations, ideas. And finally, what Paul mentioned is about freedom. So this is a national vanguard. Paul has led this in sense on behalf of the partnership to say we want freedoms. So one of the freedoms is about assets, so that Paul can control his assets and actually think about how we work with partners, including the council, to say, you know what, let's put these things together more smartly. But there might be other freedoms that you say, do you know what, please ask for this, because we think it's going to make a difference to how we integrate or how we deliver these. So I don't know if you've got any closing remarks, Paul, before we're going to move on.
Well, I just think that we've started on this journey about really about bringing health and social care together. But actually, as what we're starting to see really is that the solutions to sustainable care is really a much more whole system approach. And what we're seeing in terms of the way we're starting to engage with our population is that the questions that they have and the solutions they need, the consequence may be a use of health and social care, but actually the support they need is something very different. So we see this increasing as very much about actually how the much wider public and voluntary sector, how do we work together in the community to support people in living much healthier and sustainable lives.
So in summary, come to our pitch, come to our event, and it's about the place, not about organisations. It's the place which is done, a fantastic place, but it's about how the place is supported and assisted, not organisations. I think that's it then.
Yep.
Thank you. Have a good day.